What is up, guys? I'm back with another video, and today we're going to be looking at the different main types of lung cancer, and specifically looking at the general locations of the lung that each of them are in, along with some of the presentations of each, and then also some of the associated characteristics of each. So let's get right into this. These are the primary lung cancer types that you really should know for your board exam. We're going to begin, and notice that in a lot of these I've bolded different parts. I've put little quotations to mark kind of different mnemonics and tricks to remember all of these, because when you see a table of all of these different lung cancer types, you'll notice that it's rather long and difficult to remember, especially the locations where each of them presents, who they present in, different associated symptoms and whatnot. So I'm hoping that this mnemonic helps you as much as it's been helping me. So let's move right into this. The first one is going to be small cell lung cancer. So before we get into that, actually, I wanted to go ahead and let you know that there are two primary types of lung cancer, like subtypes within all of the lung cancers. So you have what's called small cell type of lung cancer, and there's only one type, and that's of course called small cell lung cancer. And then you have the large cell type, or I'm sorry, the it's non-small cell is what it's called, because there's one specifically called large cell, which is within this subtype. And these are the two major classifications: small cell lung cancer types, and then the non-small cell lung cancer type. So this is the small cell type, which is common sense, small cell. And then all of these are basically everything else would be considered a non-small cell lung cancer type. Really, carcinoid syndrome is kind of separate from that, but we'll go ahead and include it here. So we'll start with small cell lung cancer. The first thing right off the bat is small cell. It has an S at the beginning. So I have basically developed a way to remember all of the primary things that are important. I'm going to title this the S disease. And the same thing is going to go with squamous cell carcinoma. It also starts with an S, and this is going to also be S disease, but it's a little bit different in this. So back to small cell lung cancer. This is the S disease. Why is it called the S disease? Well, because to begin, small cell lung cancer is made up of undifferentiated small cells. Undifferentiated small cells. That's important because undifferentiated cells are earlier on in the lineage, or you could say that these are closer to the starting point in the cell lineage pathway of cell development. So S stands for start. This will help you remember these are undifferentiated small cells. These are the start cells. So that'll help you remember undifferentiated cells are in this type. So this is a neoplasia of undifferentiated cells. Then we move on to some of the associated things. So I'm going to skip forward over here to where it says male smokers. So the S disease goes along with the fact that this disease is associated highly with people who smoke, specifically males who smoke. So now what about the location of this cancer? So this cancer is located, like if you're looking at the lungs, here's the left, and the left really, so if you're looking at a patient, it would actually be on x-ray. This is the left side and this is the right. If you look at the lungs, they're more in the central part of the lungs, toward the center of the body is where small cell lung cancer primarily presents. And the way I remember that is central. Even though central is actually spelled with a C, it's pronounced as if it's spelled with an S. So it goes along with the S disease. It's central in location. And then we're going to move into now the presentation of this disease. Of course, think of all the symptoms in cancer: loss of weight, fatigue, and kind of generalized. Sometimes you can have a very low-grade fever that won't seem to go away. Those are just the general features of kind of all cancers. But there's some other associated specific symptoms in small cell. You will often see a patient who will be having lambert-eaton syndrome along with this disease. Now let me remind you what lambert-eaton syndrome is. Do you remember learning about myasthenia gravis and lambert-eaton syndrome? They kind of are similar, but they differ in a specific way. I'm going to first talk about myasthenia gravis. In myasthenia gravis, the disease gets worse the more you use muscles. In other words, these are two diseases that cause muscle weakness. So in myasthenia gravis, which is similar to Lambert-Eaton, the more you use your muscles, the more weaker your muscles get. But in Lambert-Eaton, they start weak and then they get better the more you use it. For example, if you told a patient to clench and keep making a fist and then open back your hand, make a fist, and you told them to do that really rapidly, in Lambert-Eaton syndrome, it would be hard to do it at the beginning, but as they keep moving their hand, it becomes easier and easier. So in other words, the deficit of the muscle weakness is at the start. So that helps me remember the start disease. In other words, the symptomatic problems in Lambert-Eaton are all at the beginning. So this is start disease. That goes along with our S disease. The next thing is that this disease has all of what's called the syndromes, everything that ends with the syndrome. Let me show you what I mean. Cushing syndrome. Cushing syndrome is from increased ACTH. So you will have basically nonstop production of ACTH usually associated with this cancer, or could be associated. Another example one, syndrome of inappropriate ADH. See, there's the syndrome again. So there's syndrome, there's syndrome. This is going to be an inappropriate constant production secretion of antidiuretic hormones. So think of all the ways that would present. And so these are this disease is going to have all of these type of syndromes associated with it, except for one. The one that is not associated with small cell lung cancer, but is associated with squamous cell carcinoma, is going to be dealing with PTH, parathyroid hormone, and we're going to talk about a mnemonic, how you're going to remember that in the next one. So we have all of that. We have a possibility of SIADH, Cushing syndrome, or any of the other syndromes, you name it. If it has syndrome in it, it can probably cause it as far as ectopic hormone secretion, and that's involved with small cell lung cancer. So we have the S disease. That's all for small cell lung cancer. Now the next one is squamous cell carcinoma. Same thing again, we have the S disease. So the S goes for the smokers. Remember, specifically mainly in males. You have the central because it sounds like an S. And then we have some other things to help us in this one. When you look at squamous, you see here the first letter is an S to help us remember this is an S disease, but the next letter is a Q. I want to remind you back to biochemistry, maybe even early physiology, about GQ coupled receptors or GQ coupled protein signal transduction. Remember that in GQ coupled, you're dealing with calcium influx coming from the sarcoplasmic reticulum, and that's going to be ending up how you get those effects and that type of signal transduction. So when I see the Q in squamous, it helps me remember that we're dealing with the PTH over secretion and overproduction. So in this situation, remember that PTH stands for parathyroid hormone. And what does parathyroid hormone do? It's going to raise your calcium levels along with decreasing your phosphate levels there at the kidney. So if it raises your calcium levels, that's how you can remember that this specific syndrome happens in squamous cell but not in small cell. All the other ones happen in small cell, but the Q should remind you that this is a GQ link. Remember then GQ, and then this is going to be ectopic PTH secretion that happens a lot of times with this type of cancer. So we covered central location, we covered that it's in male smokers, we covered that it has a PTH secretion that's usually associated with it, and then we get to this keratin pearls and bridges. So this is going to be how it presents on histology. So you'll see this little mass looking thing. It's fairly filled in, and it's kind of got these little lobules kind of going around. And this is going to be what's called a keratin pearl, and it presents in squamous cell carcinoma. And how do you remember this? Well, remember that keratin is within skin cells. It's within the epithelium of the skin. Well, just look at the title. It's called squamous cell carcinoma, and squamous cells is like the main, one of the main cells within your skin. So there's multiple layers of squamous cells towards the top of your epithelium, of the epidermis. So that will help you remember when you see keratin pearls. Keratin sounds like what is in skin, and then squamous cells is what makes up the skin epithelium. And then you have, so these are called keratin pearls. And the last thing you have is a bridge. And the way I remember that, so in other words, these are intercellular bridges. So I'm going to remove a lot of this stuff I've marked to make space. You will also have, along with keratin pearls, intercellular bridges. And so when you look at a histological slide, and you look at the area that the squamous cell carcinoma tumor is at, you'll see all throughout the tumor, there'll be these little bridge-like things with all these little spicules. It looks actually like a little wooden bridge, and they'll be all over the tumor. This is kind of diagnostic for squamous cell carcinoma. How do you remember this? Well, because squamous, let's go back to the word squamous. Squamous cells, if you remember from histology, they're very flat cells. Very, very flat cells. And it looks a lot like a bridge. So when you think of a bridge has a little wooden board here, and it looks a lot like a squamous cell. So that helps me remember intracellular bridges. So this is also the S disease, but it's adding GQ, and then we use squamous in the word squamous cell carcinoma to remember keratin pearls and bridges. Okay, so that covers these two. I want to emphasize that these are central in location, because all the other ones we're going to go over now are more peripheral in location, and I will tell you how to remember those. The next one is adenocarcinoma. Adeno, I look at the A, and I use the A to remember adjacent. When I think of something adjacent to something, I think that it's next to something. So if we have a lung, think of something next to the lung, and that'll help you remember that this is to the periphery. So this cancer presents on the to the periphery of the lungs, not in the center like the other two we talked about. And then, this is kind of a funny mnemonic, but I promise, it's really stupid, but it will stick with you. Adenocarcinoma, or adenocarcinoma, but it pronounced adenocarcinoma. So it sounds like a Denny's, and I think of a Denny's waiter. I don't know if you remember the movie The Santa Claus, which is a very famous Christmas movie. And in that movie, they end up going to Denny's. In the movie, it was the dad and then his son. So he took his son to Denny's because he messed up when he was trying to cook a Christmas meal for him. And when they got to Denny's, they had a Denny's waiter, and it was a female waiter that had, and you know, Denny's waiter outfits, like for females, they have like little dresses and they're kind of a little tie, and then it's kind of an old school waiter dressing style. So anytime I think of a Denny's waiter, I always think of a female. That's important because this disease is highly associated with female smokers. So if you see a question and it's a female that's been smoking a lot, it's a higher chance that the question is referring to adenocarcinoma instead of one of the other two that have male smokers as the main prevalence for the disease in small cell and squamous cell carcinoma. And also, this is the most common cancer in non-smokers. So not only is this, so this is going to be one of two things. It's either going to be a female smoker, or it's going to be a non-smoker. Female smoker or non-smoker. And these are the two that you really need to be thinking of adenocarcinoma. Okay, so let's move to the next one. The next one is large cell carcinoma. This mnemonic helps me a lot as well. Large cell, I think of large breast. And there's a reason I think of that. Because with large breast, when you think of really large breast, it makes you think of gynecomastia. What is gynecomastia? Remember, that is when a male is developing breasts kind of like a female. So their breast tissue kind of gets, enlarged, and it's called gynecomastia. Another thing that can happen in this disease is galactorrhea. That's when you make milk from your breast when you're not supposed to. And that can happen in males or females as well. Females who aren't pregnant or males, it can happen. Galactorrhea and gynecomastia. And both of these is due to, because this tumor, for whatever reason, causes an increase in beta HCG. And that's the thing that is tested in pregnancy tests. You measure the levels of beta HCG. So this is produced and secreted in this type of lung cancer, large cell carcinoma, and you have an increase in beta HCG, and naturally the body thinks that it's pregnant, so it causes gynecomastia and galactorrhea. But remembering large breasts, that should help you remember these two associated symptoms. And then when you look at large cell carcinoma, if you think of a pair of breasts, you know that there's one on the left and one on the right. So that is the periphery. So when you think of lung tissue, how is the disease going to present? It's going to present on the left and the right. So it's going to be to the periphery. Whereas, remember, again, I'm going to keep saying this because this is important to eliminate on, when you get a question and it gives you the location of the cancer, you can pretty much eliminate a lot of them just by knowing the location. So this is peripheral, but the small cell and the squamous cell carcinomas are both central. Okay, so that is the tricks for large cell carcinoma. And then we go into another one. It's called bronchoalveolar carcinoma. This one I just titled the C disease. Now I don't have a clever way to remember that, so you have to kind of remember that bronchoalveolar carcinoma is the C disease. Now for carcinoid syndrome, I also call it the C disease, but they both have some features of what would be considered a C disease. All right, so what are the features of C disease for bronchoalveolar carcinoma? Well, first of all, this is a cancer of Clara cells. Those are the cells that help in repair and in cleaning up down in the lung tissue and kind of rejuvenation they can help replace some of the different dead cells that happen if your lung were to be damaged. So this is a cancer of Clara cells in the lung, and these Clara cells go on to be let's say neoplastic, and then it basically it puts a bunch of columnar cells down in the lung. So look here, C disease, Clara cells, columnar cells, and the last one, C distribution in the lung. So if you can remember that C disease, then let me just draw a lung and show you. If you look at any picture of a lung, you'll see this kind of shape. I want you to look at the border of the lung. The border of the lung literally makes a C. So that helps me remember, for the C disease, this is primarily happening at the periphery. So it makes a C, and that should help you remember, oh, this is talking about the periphery of the lung. Okay, so this presents in the periphery. And then the other thing for C, so we've covered the C distribution of the lung, and that lets you know that's peripheral. And the other thing is that C for clean. So think of drug addicts, and oftentimes when a recovering drug addict who's going to some rehab or whatever, they say, I've been clean for 6 months, or I've been clean for 1 month. That means they're off of drugs. They're not doing any sort of drugs. So clean should help you remember that this one is mainly in non-smokers. So it's not affiliated with smokers. The other ones that are affiliated with smokers is going to be adenocarcinoma, remember, female smokers, squamous cell carcinoma, male smokers, and small cell carcinoma. And I've talked about the tricks to remember that. But in this particular example, C is for clean, so this is in non-smokers. And then the last one is carcinoid syndrome. This is kind of a subtype within all of this. Carcinoid syndrome, I don't have too many. I mean, I have a mnemonic. Of course, carcinoid starts with the C, so this is another C disease example. But there's a lot of other features of carcinoid syndrome. Carcinoid syndrome can also present with diarrhea, and it can present with flushing. And the whole reason behind this is because of carcinoid syndrome produces serotonin, and serotonin causes all of these effects. But I wanted to use a mnemonic because these are usually pretty easy to remember. I'm sure you've read about carcinoid syndrome in so many textbooks, and you've had so many questions on carcinoid syndrome because it's so high yield. But there's some other features of carcinoid syndrome, specifically in lung tissue. It presents a certain way. So it presents, remember, C disease, C for cauliflower. And that's to help you remember that this is a papilla type cancer. What does that mean? When you look at it on histology, it has a real narrow part where it connects from the lung, and then it goes out real wide. And this is a papillated type of cancer. And notice that this looks like cauliflower. If you look at cauliflower, cauliflower has a little stalk area, and then it kind of goes like this, and then it goes back down to the stalk. So that helps me remember cauliflower. Oh, this is a papillated shape on histology. And then again, C for clean, so this isn't really associated with smoking as much as some of the other ones. And then C for chromogranin positive. What does that mean? Carcinoid syndrome is involved with neuroendocrine cells, and they're involved with neuroendocrine cells that secrete from neural input that causes secretion of what? They cause the secretion of serotonin that causes all these symptoms. So C for chromogranin positive. That's a test you can do that will stain neuroendocrine cells that are within this tumor. I think it's a bluish color, but don't hold me on that. What's really important is that I think it's actually a bluish green. But what's really important is understanding what causes this and to remember C disease for specifically when it's in lung tissue. I also want to bring you up here now. We said that, I'm going to go back to the first one right here. So let me clear the page. We said that small cell is the S disease. Small cell carcinoma is the S disease. But there is something you have to remember by yourself here, and that is that it is also chromogranin positive, okay? So not only is carcinoid syndrome chromogranin positive, that is asked so much that a lot of Q banks have stopped asking that because it's too easy. But having to remember that small cell carcinoma is chromogranin positive is very high yield because a lot of kids don't realize that. So chromogranin positive is just a test to measure what? The neuroendocrine cells, and of course those cells are involved in a lot of the ectopic secretions of all of the things in the syndromes. Remember all the different syndromes we talked about. ADH. Remember the syndrome of inappropriate ADH. There's the S for syndrome. And then you have Cushing syndrome, right? Cushing syndrome is increased ACTH. So those two things are really high yield to know for that disease. So I hope this helped you. This helps me to remember all of these real picky little details because a lot of these sound really similar, but if you can keep a lot of these facts straight, you should get all the questions right on test day. So if this helped you, please subscribe to the channel. I release videos pretty much weekly. Like the video, share the video, and I will see you in another video. Bye, guys.